about that as well with you guys. So the first thing I want to talk about was there's an interesting new treatment for obesity that's actually getting some popularity. Now, this is kind of being looked at by a group of clinicians that are based out of Italy, Rome, Italy to be specific. Dr. Robert Ienka, who's from the Clinico Nuova Villa Claudia, him and a few other researchers are trying a new way of potentially helping people with weight loss. They're actually encouraging people to try a swallowable gastric balloon, right? It's called the Illurion balloon. So, and it basically, they have you swallow a balloon that is then inflated in your stomach, right? So that gives your stomach this kind of fullness sensation. Then they combine that with a glucagon-like peptide, or like all the things we've been discussing, of course, like the big popular pills like Ozempic and Wegovy, all these glucagon-like peptides, which are designed to basically make you feel very full and just kill your hunger drive and all that. And they basically use to swallow the balloon with shots of these what we call glucagon-like peptides. I'll just say GLP-1 agonists. And they combine those two and use them to see if they can help patients lose weight. Now, what they found was that when you do these two together, there was a pretty amazing weight loss result as opposed to them working by themselves. Now, usually these two things are rarely combined. It's felt that the shot can provide enough feelings of fullness and satiety that alone has been effective in helping people lose weight. But this group wanted to take it a step further and actually put a physical obstruction, which is a big balloon in the stomach, combined with the shots, which help reduce appetite. And they definitely got some good effects. Now, what they found was that the people who did this kind of treatment, and they did it for a period of about 16 weeks. And then after 16 weeks, the balloons were removed, but they continued for the shots for about 4 months. And so what they found was that those who did this, they actually had a mean reduction of their BMI. Okay, their BMI was reduced about 6.4 kilograms per meters, or almost like 13 pounds. So, pretty effective for those who, were just kind of given this treatment, and then they were allowed to do what they liked as far as eating. But they were encouraged to eat, healthy Mediterranean style foods and lower calorie. But of course, with these two things, the balloon in their stomach and the shots, they're going to be really, they're going to have a much easier time not wanting to eat just because of those interventions. So ultimately, this definitely will work. I can definitely say, as someone who's, been using the GLP agonists personally, I can definitely say that your appetite will be drastically reduced